Question 1. The assessment process reveals that a client prescribed a psychotropic medication for anxiety has been exhibiting increased agitation and difficulty sleeping, which are potential side effects or indicators of a need for dosage adjustment. The mental health technician, MHT, has observed these changes over the past 48 hours. What is the most appropriate course of action for the MHT? Option A. Immediately contact the prescribing physician to report the observed changes and inquire about potential medication adjustments. Option B. Discuss the client's medication side effects with another client to gather their opinion on what might be happening. Option C. Advise the client to stop taking the medication for a day to see if their symptoms improve. Option D. Document the observed changes in the client's chart, but take no further action until the next scheduled physician visit. The correct answer is A. Immediately contact the prescribing physician to report the observed changes and inquire about potential medication adjustments. Explanation: this scenario is professionally challenging because it requires a mental health technician, MHT, to interpret and act upon information regarding a client's psychotropic medication regimen, which directly impacts their mental state and well-being. The MHT must balance the need for accurate medication administration and monitoring with the client's right to privacy and autonomy, all within the strict confines of regulatory guidelines for MHTs. Careful judgment is required to ensure client safety, adherence to the treatment plan, and appropriate reporting. The correct approach represents best professional practice because it prioritizes client safety and adherence to the established treatment plan by seeking clarification from the prescribing physician. This aligns with the ethical principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. Regulatory frameworks for MHTs typically mandate that they operate within their scope of practice, which includes administering medications as prescribed and reporting any observed changes or concerns to the appropriate healthcare professional. Consulting the physician ensures that any adjustments or concerns about the medication are addressed by the individual authorized to make such decisions, preventing potential adverse effects or treatment interruptions. This also upholds the principle of fidelity by maintaining trust and accountability within the healthcare team. An incorrect approach that involves independently altering the medication dosage or frequency would be a severe regulatory and ethical failure. This constitutes practicing medicine without a license, a direct violation of MHT scope of practice regulations, could lead to serious adverse drug reactions, exacerbation of the client's condition, or even life-threatening consequences, violating the ethical principle of non-maleficence. Another incorrect approach, such as discussing the client's medication with unauthorized personnel, breaches client confidentiality and privacy rights, violating ethical principles of respect for autonomy and legal mandates regarding protected health information. Failing to report observed changes or concerns to the physician, even if the MHT believes they understand the situation, is also a failure. This neglects the MHT's responsibility to advocate for the client and ensure their treatment plan is effective and safe, potentially leading to harm and violating the duty of care. The professional decision-making process for similar situations should involve a clear understanding of the MHT's scope of practice, as defined by the relevant jurisdiction's licensing or certification board. When faced with ambiguity or potential issues regarding a client's medication, the MHT should first assess the situation for immediate safety risks. If no immediate danger is present, the next step is to consult the client's treatment plan and physician's orders. If clarification or intervention is needed, the MHT must communicate any observations or concerns clearly and concisely to the prescribing physician or the supervising nurse. Documentation of all observations, communications, and actions taken is crucial for continuity of care and legal protection. Question 2. Analysis of a client presenting with acute distress and expressing suicidal ideation requires a mental health technician, MHT, to conduct an initial assessment. The client is agitated and tearful, stating they can't go on anymore. The MHT is the first responder on the scene in a community mental health setting. Which of the following represents the most appropriate initial approach for the MHT? Option A. Prioritize de-escalation and ensuring the client's immediate safety by creating a calm environment, assessing for immediate risks of harm to self or others, and then proceeding with a structured assessment of their current mental state and needs. Option B. Administer prescribed anxiolytic medication to calm the client down, as per general protocol for agitated patients, before conducting any formal assessment. Option C. Focus solely on documenting the client's verbal expressions and observable behaviors without attempting to engage in further assessment or intervention until a psychiatrist is available. Option D. Immediately initiate a comprehensive mental status examination, focusing on gathering detailed historical information about past psychiatric episodes and current stressors before addressing the client's immediate safety concerns. The correct answer is D. Immediately initiate a comprehensive mental status examination, focusing on gathering detailed historical information about past psychiatric episodes and current stressors before addressing the client's immediate safety concerns. Explanation: this scenario presents a professional challenge because the mental health technician, MHT, is tasked with conducting a mental health assessment without direct supervision and with limited information about the client's immediate needs or history. This requires the MHT to exercise sound professional judgment, adhere strictly to established protocols, and prioritize client safety and well-being within their scope of practice. The urgency of the situation, indicated by the client's distress and potential for self-harm, necessitates a rapid yet thorough assessment. The correct approach represents best professional practice because it prioritizes immediate safety and de-escalation, which are foundational principles in mental health care. By first ensuring the client's immediate safety, and then proceeding with a structured assessment that includes gathering relevant history and observing behavior, the MHT is acting in accordance with ethical guidelines that mandate client welfare and the application of evidence-based practices. This approach also aligns with regulatory frameworks that expect MHTs to conduct assessments within their competency and to seek supervision or consult with higher-level professionals when necessary, especially in crisis situations. The systematic gathering of information, including client self-report and observable behaviors, allows for a more accurate and comprehensive understanding of the client's mental state. An incorrect approach that involves immediately administering medication without a physician's order or a clear protocol for such situations is a significant regulatory and ethical failure. This bypasses established medical procedures, potentially leading to adverse drug interactions or inappropriate treatment, and violates the principle of acting within one's scope of practice. Another incorrect approach, such as delaying the assessment to gather extensive background information before addressing the client's immediate distress, fails to meet the ethical obligation to provide timely care, especially when a client is in crisis and at risk. This delay could exacerbate the client's condition and increase the risk of harm. Finally, an approach that focuses solely on documenting the client's presentation without actively engaging in assessment or intervention, or without seeking appropriate support, neglects the core responsibilities of an MHT in a crisis situation. This demonstrates a lack of proactive engagement and a failure to uphold the duty of care. The professional decision-making process for similar situations should involve a rapid risk assessment, prioritizing immediate safety, followed by a structured assessment that gathers essential information efficiently. MHTs should always be aware of their scope of practice and the protocols in place for their facility. In situations involving potential self-harm or acute distress, immediate de-escalation and safety measures are paramount. If the situation exceeds the MHT's training or the established protocols, seeking immediate consultation with a supervisor or a licensed mental health professional is a critical step. Documentation should be thorough and contemporaneous, reflecting the assessment, interventions, and any consultations. Question 3. Benchmark analysis indicates that a client diagnosed with generalized anxiety disorder is experiencing significant distress, reporting racing thoughts, and a feeling of impending doom while waiting for a scheduled therapy session. The client is fidgeting and appears visibly agitated. As a mental health technician, what is the most appropriate initial response to support the client's immediate needs while adhering to professional standards and the established treatment plan? Option A. Advise the client to simply wait patiently for their therapist, assuring them that the session will begin shortly and their feelings will pass. Option B. Gently encourage the client to utilize the deep breathing and grounding techniques they have practiced in previous sessions to manage their anxiety. Option C. Immediately inform the client that their anxiety is irrational and suggest they try to distract themselves by reading a magazine. Option D. Offer to contact the client's psychiatrist to request a PRN, as needed, medication to help calm them down before their therapy session. The correct answer is B. Gently encourage the client to utilize the deep breathing and grounding techniques they have practiced in previous sessions to manage their anxiety. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the mental health technician to balance the immediate need for client comfort with the long-term goal of therapeutic intervention for an anxiety disorder. The client's distress is palpable, creating pressure to alleviate symptoms quickly. However, a technician's role is not solely symptom management, but also to support the therapeutic process, which may involve some level of discomfort as the client engages with their anxiety. Misjudging the appropriate level of intervention can either hinder progress or inadvertently reinforce avoidance behaviors. Correct approach analysis. The correct approach demonstrates best professional practice by acknowledging the client's distress while gently guiding them towards coping mechanisms that are part of their established treatment plan. This aligns with the ethical principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. Specifically, it supports the client's autonomy by empowering them with learned skills, rather than offering a quick fix that bypasses their active participation in recovery. This approach respects the established therapeutic relationship and the client's agency in managing their condition, as outlined in general mental health care guidelines that emphasize client-centered and skill-based interventions. Incorrect approaches analysis. One incorrect approach involves immediately offering a sedative or medication without consulting the treatment team or exploring non-pharmacological interventions. This fails to adhere to protocols that prioritize least restrictive interventions and may violate guidelines regarding medication administration and the technician's scope of practice, which typically requires physician orders and a comprehensive assessment. It also bypasses the client's learned coping skills, potentially undermining their confidence and reinforcing reliance on external solutions. Another incorrect approach is to dismiss the client's feelings or tell them to just relax. This is ethically unsound as it invalidates the client's experience, violating the principle of respect for persons, and potentially causing further distress or mistrust. It also fails to provide any support or guidance, neglecting the technician's duty of care. Such a response could be seen as a failure to provide appropriate support as mandated by professional standards. A third incorrect approach might be to engage in excessive reassurance or distraction that completely avoids the client's anxiety triggers. While well-intentioned, this can inadvertently reinforce avoidance, a core feature of many anxiety disorders. It prevents the client from practicing their coping skills in the presence of anxiety, which is crucial for desensitization and building resilience. This approach, while seemingly compassionate, can be detrimental to long-term therapeutic goals and may not align with evidence-based practices for anxiety management. Professional reasoning. Professionals should utilize a decision-making framework that begins with a thorough assessment of the client's current state, considering their diagnosis and established treatment plan. This involves active listening to understand the client's subjective experience and identifying the specific triggers or thoughts contributing to their anxiety. The next step is to consult the treatment plan for prescribed interventions, prioritizing non-pharmacological strategies and skill-based approaches. If the client's distress is severe or escalating beyond their current coping capacity, the framework dictates consulting with the supervising clinician or treatment team for further guidance or potential adjustments to the plan. Throughout this process, maintaining a supportive, non-judgmental demeanor and respecting the client's autonomy are paramount. Question 4. To address the challenge of a client exhibiting escalating agitation and expressing thoughts of self-harm, what is the most appropriate initial step for a mental health technician to take to ensure client safety while respecting their rights and adhering to professional standards? Option A. Restrain the client physically to prevent any immediate harm to themselves. Option B. Advise the client to simply try to calm down and ignore the thoughts, as they are likely not serious. Option C. Immediately initiate a comprehensive risk assessment involving consultation with the supervising nurse and documenting all observations and client statements. Option D. Discuss the client's expressed thoughts of self-harm with other clients on the unit to gather their perspectives. The correct answer is C. Immediately initiate a comprehensive risk assessment involving consultation with the supervising nurse and documenting all observations and client statements. Explanation. This scenario is professionally challenging because it requires the mental health technician to balance the immediate need for safety with the client's right to autonomy and privacy, all while operating within strict regulatory guidelines for mental health services. The technician must accurately assess risk without overstepping professional boundaries or violating client confidentiality. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based risk assessment that involves collaboration with the treatment team and adherence to established protocols. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as well as regulatory requirements for documentation and reporting of client status and safety concerns. It ensures that interventions are tailored to the individual's needs and are implemented in a manner that respects their dignity and rights. An incorrect approach that focuses solely on immediate physical restraint without a thorough assessment fails to consider the underlying causes of the client's distress and may escalate the situation, potentially leading to further harm or trauma. This could violate regulations regarding least restrictive interventions and client rights. Another incorrect approach that involves sharing sensitive client information with unauthorized individuals, even with good intentions, constitutes a breach of confidentiality, violating privacy laws and ethical codes. Failing to document the assessment and interventions accurately and thoroughly is a significant regulatory and ethical failure, as it compromises accountability, continuity of care, and legal protection for both the client and the professional. Professionals should employ a decision-making framework that begins with a thorough understanding of the client's presentation and history. This involves active listening, observation, and gathering information from reliable sources, including the client themselves and other members of the treatment team. The next step is to identify potential risks and protective factors, using validated assessment tools and clinical judgment. Based on this assessment, the professional should consult with supervisors or colleagues to determine the most appropriate course of action, prioritizing interventions that are least restrictive while ensuring safety and promoting client well-being. Documentation should be meticulous at every stage. Question 5. Research into best practices for supporting individuals with eating disorders has highlighted the importance of a multidisciplinary approach. A mental health technician observes a patient exhibiting significant anxiety and avoidance behaviors around a specific meal, which appears to be a deviation from their established meal plan. What is the most appropriate course of action for the technician? Option A. Discuss the observed behaviors and concerns with the interdisciplinary treatment team, including the physician and registered dietitian, to collaboratively determine the next steps and ensure the patient's safety and therapeutic progress. Option B. Avoid addressing the patient's anxiety and avoidance behaviors directly to prevent causing further distress or conflict. Option C. Immediately implement stricter dietary restrictions for the patient to prevent them from engaging in disordered eating behaviors during that meal. Option D. Respect the patient's apparent desire to avoid the specific food group without further inquiry, assuming it is a personal preference. The correct answer is A. Discuss the observed behaviors and concerns with the interdisciplinary treatment team, including the physician and registered dietitian, to collaboratively determine the next steps and ensure the patient's safety and therapeutic progress. Explanation. This scenario presents a professional challenge due to the sensitive nature of eating disorders and the critical role of a mental health technician in supporting patient recovery. The technician must balance providing direct care with respecting patient autonomy and adhering to established treatment protocols. Careful judgment is required to ensure interventions are therapeutic, non-coercive, and aligned with the patient's individualized treatment plan. The correct approach represents best professional practice because it prioritizes a collaborative and evidence-based strategy. It involves consulting with the interdisciplinary treatment team, including the physician and registered dietitian, to ensure any intervention is medically sound, nutritionally appropriate, and psychologically supportive. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, by ensuring interventions are not detrimental to the patient's physical or mental health. Furthermore, it upholds the principle of respect for autonomy by seeking to understand the patient's perspective and involving them in the decision-making process, as mandated by patient rights regulations and ethical codes that emphasize informed consent and shared decision-making. An incorrect approach that involves unilaterally imposing dietary restrictions without team consultation fails to recognize the complexity of eating disorders and the need for a multidisciplinary approach. This could lead to iatrogenic harm, such as exacerbating the patient's anxiety around food, undermining trust in the treatment team, and potentially triggering a relapse. This violates the principle of non-maleficence and may contravene regulations regarding patient care standards and the scope of practice for a mental health technician, who is not authorized to independently dictate medical or nutritional interventions. Another incorrect approach that involves ignoring the observed behaviors due to fear of upsetting the patient is a failure to act in the patient's best interest and a dereliction of professional duty. This inaction can allow the eating disorder to progress unchecked, leading to severe physical and psychological consequences. It contravenes the ethical obligation to advocate for the patient's well-being and may violate regulations requiring reporting of observed changes in patient condition that could indicate a decline in health. A third incorrect approach that involves solely focusing on the patient's expressed desire to avoid a particular food group without further investigation disregards the underlying psychological and physiological factors contributing to the eating disorder. This superficial approach can reinforce disordered eating patterns and prevent the patient from addressing the root causes of their difficulties. It fails to meet the standard of care for treating eating disorders, which requires a comprehensive assessment and intervention strategy, and may be considered a breach of professional responsibility under relevant mental health practice acts. Professionals should employ a decision-making framework that begins with thorough observation and documentation of patient behavior. This should be followed by immediate consultation with the interdisciplinary treatment team to discuss findings and collaboratively develop an appropriate course of action. Open and empathetic communication with the patient, explaining the rationale behind interventions and seeking their input, is crucial throughout the process. This systematic approach ensures that care is patient-centered, evidence-based, and ethically sound, while adhering to all applicable regulations. Question 6. Stakeholder feedback indicates a need for clearer guidance on how mental health technicians should respond to clients exhibiting acute distress potentially related to past trauma. A client who has a history of trauma begins to exhibit signs of significant anxiety, dissociation, and emotional lability during a group session. The MHT observes these changes and the client's increasing agitation. What is the most appropriate initial response for the mental health technician? Option A. Gently guide the client to a quieter space, offer to sit with them, and provide simple grounding techniques to help them manage their immediate distress, while discreetly informing the supervising clinician of the client's state. Option B. Immediately ask the client to describe the specific traumatic memories that are surfacing to help them process the experience in the moment. Option C. Advise the client to try and snap out of it and focus on the present moment, suggesting they are overreacting to the situation. Option D. Ignore the client's distress, assuming it is a temporary reaction to the group setting that will resolve on its own without intervention. The correct answer is A. Gently guide the client to a quieter space, offer to sit with them, and provide simple grounding techniques to help them manage their immediate distress, while discreetly informing the supervising clinician of the client's state. Explanation. This scenario is professionally challenging because it requires a mental health technician, MHT, to navigate the complexities of trauma-informed care while adhering to specific regulatory requirements for documentation and client interaction. The MHT must balance the immediate need to support a client experiencing acute distress with the long-term goal of facilitating recovery, all within the established legal and ethical boundaries of their practice. Careful judgment is required to ensure interventions are both therapeutically effective and compliant with the mental health technician certification regulations. The correct approach represents best professional practice because it prioritizes a client-centered, trauma-informed intervention that aligns with established ethical guidelines for MHTs. This approach acknowledges the client's distress, validates their experience, and offers immediate, supportive coping strategies without overstepping the MHT's scope of practice. It also includes appropriate documentation, which is a critical regulatory requirement for continuity of care and accountability. This method respects the client's autonomy and promotes a sense of safety and trust, which are foundational in trauma recovery. An incorrect approach that focuses solely on immediate symptom suppression without addressing the underlying trauma or involving the clinical team fails to meet the comprehensive care standards mandated by the Mental Health Technician Certification Framework. This could lead to a superficial resolution of distress, potentially masking deeper issues and hindering long-term recovery. It also represents a failure to adhere to the regulatory requirement of collaborative care and appropriate reporting. Another incorrect approach that involves probing for detailed traumatic event specifics without proper clinical authorization or training is a significant ethical and regulatory violation. This can re-traumatize the client, breach confidentiality, and exceed the MHT's defined scope of practice, potentially causing harm and undermining the therapeutic relationship. Such an action would contravene regulations regarding client safety and professional boundaries. A further incorrect approach that dismisses the client's distress or minimizes their experience is antithetical to trauma-informed care principles and regulatory expectations. This can lead to client alienation, a breakdown of trust, and a failure to provide necessary support, potentially exacerbating the client's condition. It demonstrates a lack of understanding of the impact of trauma and a failure to uphold the duty of care. The professional decision-making process for similar situations should involve a rapid assessment of the client's immediate needs, a clear understanding of the MHT's scope of practice and regulatory limitations, and a commitment to a trauma-informed, client-centered approach. This includes active listening, validation, offering immediate coping strategies within one's expertise, and knowing when and how to escalate concerns or seek further guidance from the clinical team. Documentation should always be accurate, timely, and reflect the interventions provided and the client's response. Question 7. Cost-benefit analysis shows that while immediate symptom relief for stimulant withdrawal can improve client comfort, a mental health technician observing a client experiencing severe agitation, tremors, and paranoia during withdrawal must prioritize adherence to established protocols. Which of the following actions best aligns with regulatory requirements and ethical practice for a mental health technician in this situation? Option A. Reassure the client with verbal de-escalation techniques and offer a warm beverage, as these are standard non-pharmacological interventions for withdrawal. Option B. Administer a prescribed PRN sedative from the client's medication cart to alleviate the agitation, assuming it is part of standard withdrawal management. Option C. Document the client's symptoms and advise them to wait until their scheduled physician visit to discuss their discomfort. Option D. Immediately report the client's severe symptoms and vital signs to the supervising nurse or physician to obtain a medical order for appropriate intervention. Correct answer is D. Immediately report the client's severe symptoms and vital signs to the supervising nurse or physician to obtain a medical order for appropriate intervention. Explanation. This scenario is professionally challenging because it requires a mental health technician to balance the immediate needs of a client experiencing stimulant withdrawal with the established protocols for medication administration and client safety. The technician must exercise sound judgment in assessing the client's condition, understanding the potential risks and benefits of intervention, and adhering to the scope of practice and regulatory guidelines. The correct approach represents best professional practice because it prioritizes client safety and well-being while operating within the defined scope of practice for a mental health technician. Adhering to the established protocol for reporting and seeking physician orders ensures that any intervention is medically appropriate, authorized, and documented. This aligns with regulatory frameworks that mandate supervised care, accurate record keeping, and the prevention of unauthorized medical interventions. The technician's role is to observe, report, and support, not to independently initiate or alter medication regimens. An incorrect approach that involves administering a sedative without a physician's order represents a significant regulatory and ethical failure. This constitutes practicing medicine without a license and violates the principle of client autonomy and informed consent, as the client has not agreed to this intervention under medical supervision. It also bypasses established safety protocols designed to prevent adverse drug interactions or inappropriate treatment. Another incorrect approach, such as dismissing the client's symptoms as typical withdrawal and offering only non-pharmacological comfort measures without further assessment or escalation, fails to adequately address potential medical complications. While non-pharmacological support is important, it may not be sufficient for severe withdrawal symptoms, and failing to involve the physician could delay necessary medical intervention, potentially leading to client harm. This breaches the duty of care and the expectation of vigilant observation and reporting. The professional decision-making process for similar situations should involve a clear understanding of the mental health technician's scope of practice, the facility's policies and procedures, and the specific needs of the client. Technicians should first conduct a thorough assessment of the client's symptoms and vital signs. If the symptoms are severe or concerning, the immediate next step is to report these observations to the supervising nurse or physician. This ensures that a qualified medical professional can evaluate the situation and provide appropriate medical direction. Documentation of all observations and communications is crucial for continuity of care and regulatory compliance. Question 8. Which approach would be most appropriate for a mental health technician when a client diagnosed with schizophrenia is agitated, pacing, and reporting that people are watching me through the walls and the voices are telling me to hide? Option A. Immediately attempt to physically restrain the client to prevent them from harming themselves or others, as their behavior suggests a loss of control. Option B. Continue with scheduled group activities as if the client's statements are not significant, assuming they will eventually return to baseline behavior. Option C. Gently acknowledge the client's distress and fear, validate their feelings without confirming the delusion, and attempt to redirect their attention to a calming activity or a discussion about their immediate needs. Option D. Directly confront the client by stating, "There is no one watching you, and those voices are not real. You need to calm down." Correct answer is C. Gently acknowledge the client's distress and fear, validate their feelings without confirming the delusion, and attempt to redirect their attention to a calming activity or a discussion about their immediate needs. Explanation. This scenario presents a common challenge in mental health settings. Responding to a client experiencing acute psychotic symptoms, specifically auditory hallucinations and paranoid delusions, while ensuring their safety and maintaining therapeutic rapport. The professional challenge lies in balancing immediate safety concerns with the client's autonomy and the need for a non-confrontational, validating approach that does not reinforce delusional beliefs, but also does not dismiss the client's subjective experience. The correct approach prioritizes de-escalation, validation of the client's distress without validating the delusion itself, and redirection towards reality-based interventions. This aligns with best practices in mental health care, emphasizing person-centered care and therapeutic communication techniques. Specifically, it adheres to ethical guidelines that mandate providing compassionate care, respecting client dignity, and ensuring safety. Regulatory frameworks for mental health technicians typically require them to operate within their scope of practice, which includes de-escalation and supportive interventions, and to collaborate with licensed professionals. This approach avoids challenging the delusion directly, which can increase agitation and distrust, and instead focuses on the client's feelings and the impact of their experiences. An incorrect approach that directly challenges the delusion, "Those voices aren't real," is professionally unacceptable because it can alienate the client, escalate their paranoia, and damage the therapeutic alliance. This violates ethical principles of respect and non-maleficence, as it can cause further distress. Another incorrect approach that involves immediate physical restraint without a clear and present danger assessment or prior de-escalation attempts is also professionally unacceptable. This could constitute a violation of the client's rights and potentially lead to legal or regulatory repercussions, as restraint is typically a measure of last resort, requiring specific protocols and justification. Ignoring the client's distress and continuing with a routine task without acknowledging their acute symptoms is also professionally unacceptable, as it demonstrates a failure to assess and respond to a client's immediate needs, potentially leading to a safety incident and violating the duty of care. The professional decision-making process in such situations should involve a rapid assessment of the client's safety and the safety of others, followed by the application of de-escalation techniques. This includes active listening, empathetic responses, and attempting to understand the client's perspective without agreeing with the delusional content. The mental health technician should then communicate their observations and concerns to the supervising clinician or treatment team to ensure appropriate medical or psychiatric interventions are initiated. This collaborative approach ensures that the client receives comprehensive care tailored to their acute needs, while adhering to professional standards and regulatory requirements. Question 9. The review process indicates a client presence with persistent feelings of sadness, a noticeable decrease in interest in activities they once enjoyed, and reports significant fatigue over the past 3 weeks. The mental health technician is tasked with considering potential diagnostic impressions based on the DSM-5. Which of the following approaches best reflects the application of DSM-5 diagnostic criteria for major depressive disorder. Option A. Focusing on the client's reported fatigue as the primary symptom and exploring potential causes for this symptom in isolation, without considering other diagnostic criteria for major depressive disorder. Option B. Identifying that the client experiences sadness and fatigue, and concluding that this is sufficient to meet the criteria for a depressive disorder without further investigation into other symptom domains or duration. Option C. Evaluating if the client meets the criteria for a depressed mood and anhedonia, and assessing for the presence of at least 5 additional symptoms from the DSM-5 list, e.g. changes in appetite/weight, sleep disturbances, psychomotor agitation/retardation, fatigue, feelings of worthlessness/guilt, diminished ability to think/concentrate, recurrent thoughts of death/suicidal ideation that have been present nearly every day for at least 2 weeks, causing clinically significant distress or impairment. Option D. Diagnosing the client with major depressive disorder based solely on their report of feeling sad and fatigued, as these are common indicators of depression. The correct answer is C. Evaluating if the client meets the criteria for a depressed mood and anhedonia, and assessing for the presence of at least 5 additional symptoms from the DSM-5 list, e.g. changes in appetite/weight, sleep disturbances, psychomotor agitation/retardation, fatigue, feelings of worthlessness/guilt, diminished ability to think/concentrate, recurrent thoughts of death/suicidal ideation that have been present nearly every day for at least 2 weeks, causing clinically significant distress or impairment. Explanation: this scenario is professionally challenging because accurately applying diagnostic criteria from the DSM-5 requires careful observation, nuanced understanding of symptom presentation, and the ability to differentiate between similar conditions. A mental health technician's role involves direct client interaction and initial assessment, making their interpretation of observed behaviors critical for subsequent care planning. Misinterpreting or misapplying diagnostic criteria can lead to inappropriate treatment, delayed recovery, and potential harm to the client. The correct approach represents best professional practice because it adheres strictly to the established diagnostic guidelines of the DSM-5, which are the standard for mental health diagnosis in the United States. This ensures consistency, reliability, and validity in assessment, forming the foundation for evidence-based treatment. By focusing on the specific symptom clusters and duration requirements outlined in the DSM-5 for major depressive disorder, the technician demonstrates a commitment to accurate diagnostic formulation, which is a core ethical and professional responsibility. This aligns with the overarching goal of providing client-centered care based on a sound diagnostic understanding. An incorrect approach that relies solely on a client's self-report without corroborating observable behaviors or considering the full spectrum of DSM-5 criteria fails to meet professional standards. This approach risks oversimplification and could lead to a misdiagnosis if the client's subjective experience does not fully align with the objective diagnostic requirements. Ethically, it neglects the technician's responsibility to conduct a comprehensive assessment. Another incorrect approach that focuses on a single prominent symptom without evaluating the presence and severity of other required symptoms for a specific diagnosis is also professionally unacceptable. The DSM-5 is a symptom-based classification system. A diagnosis requires meeting a specific number and combination of symptoms over a defined period. Ignoring this systematic approach leads to incomplete and potentially erroneous diagnostic conclusions, violating professional standards of care. A further incorrect approach that generalizes symptoms to a broader category without specific adherence to the detailed criteria for a particular disorder, such as generalized anxiety disorder, demonstrates a lack of precision. This broad categorization can obscure the specific nature of the client's distress and hinder the development of targeted interventions. It represents a failure to apply the diagnostic framework rigorously. The professional decision-making process for similar situations should involve a systematic review of the client's reported symptoms, observed behaviors, and historical information. This information should then be cross-referenced with the specific diagnostic criteria outlined in the current edition of the DSM-5. Technicians should be trained to identify the core symptoms, duration, and impact on functioning required for potential diagnoses. When in doubt, or when the presentation is complex, seeking supervision or consultation with a licensed clinician is a critical step in ensuring accurate assessment and appropriate care planning. This iterative process of assessment, comparison with criteria, and consultation is fundamental to ethical and effective practice. Question 10. The analysis reveals that a patient prescribed a mood stabilizer for bipolar disorder reports experiencing tremors and nausea shortly after taking their evening dose. The patient appears visibly distressed and states, "I feel shaky and sick to my stomach. I don't know if I can keep this down." As a mental health technician, what is the most appropriate immediate action? Option A. Inform the patient that tremors and nausea are common side effects and they should just try to tolerate them. Option B. Suggest the patient take an extra dose of the mood stabilizer to help stabilize their mood more quickly. Option C. Advise the patient to try drinking some ginger ale and resting, as these are common remedies for nausea. Option D. Document the patient's reported symptoms and vital signs, and immediately report these observations to the supervising nurse or physician. The correct answer is D. Document the patient's reported symptoms and vital signs, and immediately report these observations to the supervising nurse or physician. Explanation. The analysis reveals a scenario where a mental health technician, MHT, is faced with a patient experiencing potential side effects from a mood stabilizer. This situation is professionally challenging because it requires the MHT to balance the patient's immediate comfort and safety with the established protocols for medication management and reporting. The MHT must recognize signs of adverse reactions, understand their scope of practice, and know when to escalate concerns to a licensed clinician. Careful judgment is required to avoid overstepping boundaries or neglecting a potentially serious issue. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the regulatory framework governing MHTs. This involves accurately observing and documenting the patient's symptoms, understanding the potential side effects of the prescribed mood stabilizer, and promptly reporting these observations to the supervising nurse or physician. This aligns with the ethical duty of care and the legal requirement to report changes in a patient's condition. The MHT's role is to be the eyes and ears of the clinical team, providing crucial information for timely and appropriate medical intervention. An incorrect approach that involves the MHT attempting to adjust the patient's medication dosage or suggesting over-the-counter remedies without clinical supervision would be a significant regulatory and ethical failure. This constitutes practicing medicine without a license, which is illegal and dangerous. It undermines the authority of the prescribing clinician and could lead to severe adverse health consequences for the patient. Another incorrect approach, such as dismissing the patient's complaints as minor or unrelated to the medication, would be a failure in the duty of care and could result in delayed diagnosis and treatment of a serious side effect. Violating ethical principles of beneficence and non-maleficence. Professional decision-making in similar situations should involve a systematic process. 1. Assess the patient's immediate condition and safety. 2. Recognize and document observed symptoms accurately. 3. Consult the patient's care plan and medication administration record for relevant information. 4. Understand the MHT's scope of practice and limitations. 5. Promptly report all observations and concerns to the appropriate licensed healthcare professional, e.g., nurse, physician. 6. Follow up as directed by the clinical team. Question 11. Process analysis reveals a client who has a history of suicidal ideation and past attempts, expresses to a mental health technician that they are feeling a bit better today and don't feel like hurting themselves right now. The technician notes the client's demeanor is somewhat withdrawn, but they are making eye contact and responding to questions. What is the best professional approach for the technician to take in assessing and managing this situation? Option A. Immediately initiate involuntary hospitalization procedures based on the client's history of suicidal ideation and past attempts. Option B. Document the client's statement and their current demeanor, but take no further immediate action, as the client has verbally denied suicidal intent. Option C. Conduct a comprehensive suicide risk assessment, utilizing standardized tools and gathering collateral information if possible, before determining the next steps in care. Option D. Accept the client's verbal assurance that they are feeling better and do not intend to harm themselves, and document this statement. The correct answer is C. Conduct a comprehensive suicide risk assessment, utilizing standardized tools and gathering collateral information if possible, before determining the next steps in care. Explanation. This scenario is professionally challenging because it requires the mental health technician to balance immediate safety concerns with the individual's right to autonomy and privacy, all while adhering to strict regulatory guidelines for risk assessment. The technician must make a judgment call based on incomplete information and the potential for severe harm. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment of suicide risk, directly aligning with the core principles of client safety and ethical care mandated by mental health technician certification standards. This approach involves gathering information from multiple sources, utilizing validated assessment tools, and collaborating with the clinical team. Such a process ensures that interventions are evidence-based and tailored to the individual's specific needs and risk factors, thereby fulfilling the duty of care and adhering to regulatory requirements for diligent risk management. An incorrect approach that relies solely on the client's verbal assurances without further investigation fails to meet the standard of care. This is a regulatory and ethical failure because it neglects the inherent unpredictability of suicidal ideation and behavior, potentially leading to a missed opportunity to intervene and prevent harm. It violates the principle of do no harm by placing undue trust in a statement that may not reflect the true level of risk. Another incorrect approach that involves immediately escalating to a higher level of care based on a single concerning statement without a thorough assessment is also professionally unacceptable. This represents an overreaction that can undermine client trust, potentially lead to unnecessary hospitalization, and may not be the most appropriate or least restrictive intervention. It fails to demonstrate the nuanced judgment required in risk assessment, potentially violating the client's right to appropriate care and potentially misallocating resources. Third incorrect approach that involves documenting the concern but taking no immediate follow-up action is a critical regulatory and ethical failure. This demonstrates a lack of diligence and a failure to act on potentially life-threatening information. It contravenes the explicit or implicit requirements of mental health regulations that mandate timely and appropriate responses to identified risks, potentially exposing both the client and the facility to liability. Professionals should use a decision-making framework that begins with recognizing the potential for risk, followed by a systematic and thorough assessment process. This involves active listening, open-ended questioning, observation of behavior, and consultation with supervisors or the treatment team. The framework should emphasize evidence-based practices, adherence to facility protocols, and a commitment to client well-being, ensuring that interventions are proportionate to the assessed risk and aligned with legal and ethical obligations. Question 12. Stakeholder feedback indicates that mental health technicians sometimes struggle with effectively managing behavioral escalations in individuals diagnosed with neurodevelopmental disorders, particularly when these behaviors interfere with scheduled therapeutic activities. A client with autism spectrum disorder is refusing to participate in a group therapy session, exhibiting signs of distress such as vocalizations and avoidance. The technician needs to decide on the most appropriate immediate course of action. Which of the following approaches best aligns with best professional practice and regulatory guidelines for supporting individuals with neurodevelopmental disorders? Option A. Contact the client's family to demand they come and force the client to participate. Option B. Attempt to understand the specific reason for the client's distress and explore alternative ways to engage them in the session or a modified activity while ensuring their safety and comfort. Option C. Immediately implement a physical restraint to ensure the client attends the group therapy session, as participation is mandatory. Option D. Ignore the client's distress and proceed with the group session, assuming the behavior is attention-seeking. The correct answer is B. Attempt to understand the specific reason for the client's distress and explore alternative ways to engage them in the session or a modified activity, while ensuring their safety and comfort. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the mental health technician to balance the immediate need for safety and de-escalation with the long-term therapeutic goals and the individual's right to autonomy, all within the context of a neurodevelopmental disorder. The technician must interpret behaviors that may be manifestations of the disorder, rather than willful defiance, and respond in a way that is both effective and respectful of the individual's dignity and rights. This requires a nuanced understanding of the specific neurodevelopmental disorder and its impact on behavior and communication. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a de-escalation strategy that is trauma-informed and person-centered, directly addressing the individual's distress without resorting to punitive measures. This aligns with the ethical principles of beneficence, acting in the best interest of the client and non-maleficence, avoiding harm. Furthermore, it adheres to regulatory guidelines that emphasize least restrictive interventions and the importance of understanding the underlying causes of behavior, particularly in individuals with neurodevelopmental disorders. This approach seeks to understand the why behind the behavior, fostering a therapeutic relationship and promoting long-term behavioral management. Incorrect approaches analysis. One incorrect approach fails by immediately resorting to physical restraint. This is a regulatory and ethical failure because it is a restrictive measure that should only be used as a last resort when there is an imminent risk of harm to self or others, and it is not the least restrictive intervention. For individuals with neurodevelopmental disorders, restraint can be particularly traumatizing and may exacerbate the underlying distress, leading to further behavioral escalation. It also fails to address the root cause of the behavior. Another incorrect approach involves dismissing the individual's concerns and proceeding with the scheduled activity without acknowledgement. This is an ethical failure, as it disregards the individual's expressed distress and potential communication challenges associated with their neurodevelopmental disorder. It can lead to feelings of invalidation, mistrust, and further agitation, undermining the therapeutic relationship and potentially violating guidelines that mandate respectful and responsive care. A third incorrect approach involves immediately involving law enforcement. This is a significant regulatory and ethical failure. Law enforcement intervention is an extreme measure and should not be the first response to behavioral challenges, especially when the individual has a known neurodevelopmental disorder. Such an action can be disproportionately punitive, traumatizing, and may escalate the situation unnecessarily, potentially leading to legal and ethical repercussions for the technician and the facility. It bypasses established de-escalation protocol and fails to consider the individual's specific needs and rights. Professional reasoning. Professionals should utilize a decision-making framework that begins with a thorough assessment of the situation, considering the individual's known diagnosis and potential triggers. This involves active listening and observation to understand the underlying cause of the distress. The next step is to identify and implement the least restrictive, most therapeutic intervention, prioritizing de-escalation and communication. If these strategies are ineffective and there is an imminent risk of harm, then more restrictive measures may be considered, always in accordance with established protocols and with appropriate documentation. Throughout this process, maintaining the individual's dignity and rights is paramount, and consultation with supervisors or interdisciplinary teams should be sought when necessary. Question 13. During the evaluation of a patient prescribed a new atypical antipsychotic medication, the patient reports experiencing a persistent buzzing sensation throughout their body and noticeable jitters in their hands. The mental health technician, MHT, is aware that this medication class can affect dopamine and serotonin pathways. Which of the following interpretations and subsequent actions best aligns with the MHT's role and the regulatory framework for mental health technician certification? Option A. The MHT explains to the patient that the buzzing and jitters are likely due to anxiety and that the medication is working to manage their underlying condition, advising them to ignore these sensations. Option B. The MHT provides the patient with a detailed explanation of how the medication's blockade of specific dopamine receptors might be causing akathisia, advising on potential management strategies. Option C. The MHT recognizes these symptoms as potential side effects related to the medication's impact on neurotransmitter systems and accurately documents and reports these observations to the supervising clinician for further assessment. Option D. The MHT dismisses the patient's report, assuming that such subjective sensations are not clinically significant for a new medication. The correct answer is C. The MHT recognizes these symptoms as potential side effects related to the medication's impact on neurotransmitter systems and accurately documents and reports these observations to the supervising clinician for further assessment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the mental health technician, MHT, to interpret a patient's subjective report of medication effects and relate it to the known mechanisms of action of psychotropic drugs. The MHT must distinguish between expected therapeutic effects, potential side effects, and signs of a more serious adverse reaction, all while adhering to the strict protocols of the Mental Health Technician Certification Regulatory Framework. The challenge lies in the MHT's scope of practice, which does not include diagnosing or prescribing, but necessitates accurate observation and reporting to the supervising clinician. Correct approach analysis. The correct approach involves the MHT recognizing that the patient's reported sensations of buzzing and jitters are consistent with known stimulant or anxiety-producing side effects of certain psychotropic medications, particularly those affecting neurotransmitter systems like dopamine or norepinephrine. This understanding allows the MHT to accurately document these observations and report them to the supervising nurse or physician. This aligns with the regulatory framework's emphasis on accurate patient observation, data collection, and communication within the interdisciplinary team, ensuring patient safety and facilitating appropriate clinical decision-making regarding medication management. The MHT's role is to be the eyes and ears of the clinical team, providing crucial information about the patient's response to treatment. Incorrect approach is analysis. One incorrect approach would be for the MHT to dismiss the patient's report as simply anxiety, without considering the pharmacological context. This fails to acknowledge the potential for medication-induced side effects, which could be indicative of an adverse drug reaction or a need for dose adjustment. Ethically, this approach neglects the patient's subjective experience and could lead to delayed or misdiagnosis of a serious issue. Regulationally, it represents a failure in thorough observation and reporting. Another incorrect approach would be for the MHT to attempt to explain the buzzing and jitters in terms of specific neurotransmitter imbalances or complex pharmacological pathways. This exceeds the MHT's scope of practice, which is focused on observable behaviors and reported symptoms, not on providing detailed pharmacological explanations to patients. Such an action could lead to patient confusion, misinformation, and potentially undermine the authority of the prescribing clinician. It violates the principle of working within one's defined professional boundaries and the regulatory guidelines for MHTs. A third incorrect approach would be to ignore the report altogether, assuming it is not significant. This is a critical failure in patient care and violates the core tenets of the MHT role, which is to monitor patient well-being and report any changes. This inaction could have severe consequences if the reported symptoms are indeed indicative of a dangerous side effect. It represents a direct contravention of the regulatory requirement for diligent patient observation and reporting. Professional reasoning. Professionals should approach such situations by first actively listening to the patient's subjective experience. Then, they should access their knowledge of common medication side effects relevant to the patient's current treatment regimen. The next step is to accurately and objectively document the reported symptoms and the patient's presentation. Finally, and crucially, the MHT must communicate these findings promptly and clearly to the supervising clinician, providing them with the necessary information to make informed clinical decisions. This systematic process ensures patient safety, adherence to scope of practice, and effective collaboration within the healthcare team. Question 14. Market research demonstrates that clients experiencing acute mental health crises often respond best to interventions that are both immediate and supportive. A mental health technician is called to assist a client who is exhibiting signs of severe agitation, verbal aggression, and a stated intent to harm themselves. The technician has been trained in several crisis intervention models, which approach best aligns with the principles of effective and ethical crisis intervention for this scenario. Option A. Focus on documenting the client's behavior in detail for the incident report before attempting any direct intervention to ensure accurate record keeping. Option B. Attempt to physically restrain the client to prevent immediate harm to themselves and then seek supervisory assistance. Option C. Engage in active listening, validate the client's feelings, and collaboratively explore immediate coping strategies and safety planning while ensuring the client's physical safety. Option D. Immediately administer prescribed PRN medication to sedate the client, and then proceed with de-escalation techniques once the client is calmer. Correct answer is D. Immediately administer prescribed PRN medication to sedate the client, and then proceed with de-escalation techniques once the client is calmer. Explanation. This scenario presents a professional challenge due to the inherent unpredictability and emotional intensity of a crisis situation, coupled with the need to adhere to established crisis intervention models and the specific regulatory framework governing mental health technicians. The technician must balance immediate de-escalation with long-term client well-being, all while operating within defined professional boundaries and legal mandates. Careful judgment is required to assess the client's immediate needs, identify potential risks, and select the most appropriate intervention strategy. The correct approach represents best professional practice because it prioritizes a structured, evidence-based crisis intervention model that emphasizes de-escalation, active listening, and collaborative problem-solving. This aligns with the ethical imperative to provide client-centered care and the regulatory requirement to utilize approved intervention techniques. By focusing on the client's immediate safety and emotional state, and then working towards a resolution, the technician demonstrates competence in managing acute distress while respecting the client's autonomy and dignity. This approach is designed to reduce immediate danger and facilitate a return to a state of equilibrium, paving the way for further therapeutic support. An incorrect approach that focuses solely on immediate symptom suppression without addressing the underlying distress or involving the client in the solution fails to meet the comprehensive requirements of crisis intervention. This could lead to a superficial resolution that does not address the root cause of the crisis, potentially increasing the risk of recurrence. Ethically, it may be considered paternalistic and disempowering to the client. Another incorrect approach that involves bypassing established protocols or attempting interventions beyond the scope of a mental health technician's certification would constitute a significant regulatory and ethical failure. This could result in harm to the client, legal repercussions for the technician and the facility, and a breach of professional trust. It demonstrates a lack of understanding of professional boundaries and the importance of working within a multidisciplinary team. A third incorrect approach that prioritizes administrative reporting over immediate client needs, while reporting is crucial, can be detrimental in an acute crisis. Delaying essential intervention to complete paperwork can exacerbate the client's distress and potentially lead to a worsening of the situation. This demonstrates a failure to prioritize immediate client safety and well-being, which is a core ethical and regulatory responsibility. The professional decision-making process for similar situations should involve a rapid assessment of the crisis, identification of immediate safety concerns, selection of an appropriate crisis intervention model based on the client's presentation and the facility's protocols, implementation of the chosen intervention with fidelity, and thorough documentation. Continuous reassessment of the client's response and adjustment of the intervention as needed are also critical. Collaboration with supervisors and other members of the care team is essential, especially when facing complex or challenging situations. Question 15. Stakeholder feedback indicates that clients with co-occurring substance use disorders and mental health conditions are experiencing inconsistent levels of care. As a mental health technician, what is the most appropriate initial approach to address this feedback and improve service delivery for this population? Option A. Refer all clients with substance use disorders directly to external specialized addiction treatment centers without any initial in-house assessment or support. Option B. Conduct a comprehensive assessment of each client's substance use and mental health status and collaboratively develop an individualized treatment plan that integrates both aspects of their care. Option C. Mandate participation in group therapy sessions focused solely on substance abuse, without first assessing individual readiness or co-occurring mental health needs. Option D. Immediately implement a standardized detoxification protocol for all clients identified with any level of substance use, regardless of their current mental health stability. Correct answer is B. Conduct a comprehensive assessment of each client's substance use and mental health status, and collaboratively develop an individualized treatment plan that integrates both aspects of their care. Explanation. This scenario presents a professional challenge due to the inherent complexity of addressing substance use disorders within a mental health setting. The challenge lies in balancing the immediate need for support with the long-term goal of recovery, while respecting client autonomy and adhering to established protocols. Careful judgment is required to ensure interventions are both effective and ethically sound, particularly when dealing with potential relapse or resistance to treatment. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered strategy that aligns with the principles of evidence-based care for substance use disorders. This involves a thorough assessment to understand the individual's specific needs, history, and readiness for change. It also emphasizes collaboration with the client in developing a personalized treatment plan, which fosters engagement and increases the likelihood of successful outcomes. This approach is supported by regulatory frameworks that mandate individualized care plans and ethical guidelines that promote client self-determination and dignity. An incorrect approach that focuses solely on immediate detoxification without addressing underlying mental health issues or providing ongoing support fails to meet the holistic needs of the client. This can lead to relapse and a perpetuation of the cycle of substance use and mental distress, potentially violating regulations that require comprehensive treatment and ethical principles of beneficence. Another incorrect approach that involves imposing a treatment plan without client input disregards the principle of client autonomy, a cornerstone of ethical practice and often a requirement in regulatory guidelines for informed consent and participation in care. This can lead to client disengagement and a breakdown in the therapeutic alliance. A third incorrect approach that neglects to involve family or support systems, where appropriate and consented to by the client, misses a crucial element in recovery for many individuals. This can hinder long-term success and may not align with best practices that recognize the social determinants of health and recovery. Professionals should employ a decision-making framework that begins with a thorough, non-judgmental assessment of the client's current state and history. This should be followed by a collaborative discussion about potential interventions, taking into account the client's preferences, goals, and perceived barriers. The development of a treatment plan should be a joint effort, with clear communication about expectations, potential risks, and benefits. Ongoing evaluation and flexibility in adjusting the plan based on the client's progress and feedback are essential components of effective and ethical care. Question 16. Regulatory review indicates that mental health technicians are required to utilize validated, standardized assessment tools when evaluating a client's mental health status. A new client presents with symptoms suggestive of depression. The technician has limited time before the next scheduled activity. Which of the following actions best aligns with these regulatory requirements and professional best practices? Option A. Engage in a brief, informal conversation to gauge the client's mood and symptoms. Option B. Administer a validated standardized depression screening tool, such as the PHQ-9, to gather objective data. Option C. Ask the client to describe their feelings using their own words and document these descriptions. Option D. Rely solely on the client's self-report of their condition as they appear articulate. The correct answer is B. Administer a validated standardized depression screening tool, such as the PHQ-9, to gather objective data. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the mental health technician to balance the immediate need for client information with the ethical and regulatory imperative to use validated, standardized assessment tools. The pressure to provide a quick assessment, perhaps due to time constraints or a perceived urgency by the client or other staff, can lead to shortcuts that compromise data integrity and client care. The technician must navigate the potential for misinterpretation or incomplete understanding if non-standardized methods are employed, which could lead to inappropriate treatment planning or a failure to identify critical needs. Correct approach analysis. The correct approach represents best professional practice because it adheres strictly to the regulatory framework for mental health technicians, which mandates the use of standardized assessment tools. These tools are designed to be reliable and valid, ensuring that the information gathered is consistent and accurately reflects the client's condition. Using a validated tool like the PHQ-9 for depression screening, as specified by the exam's regulatory guidelines, ensures that the technician is collecting data in a manner recognized by the profession and regulatory bodies. This systematic approach supports evidence-based practice, facilitates accurate diagnosis and treatment planning, and provides a benchmark for measuring progress, all of which are fundamental to quality client care and compliance with professional standards. Incorrect approaches analysis. Employing a brief, informal conversation to gauge the client's mood and symptoms without using a standardized tool represents a failure to adhere to the regulatory requirement for validated assessments. This approach is subjective, prone to bias, and lacks the reliability and validity necessary for professional documentation and treatment planning. It could lead to misdiagnosis, inadequate support, and a violation of professional conduct standards. Relying solely on the client's self-report of their condition without any structured assessment tool, even if the client appears articulate, is also a regulatory and ethical failure. A client self-report is a component of assessment. It must be corroborated and contextualized by standardized measures. This approach bypasses the requirement for objective, standardized data collection, potentially overlooking subtle but significant clinical indicators. Asking the client to describe their feelings using their own words, and then documenting these descriptions without the use of a standardized tool is another deviation. While qualitative data is valuable, the regulatory framework for mental health technicians emphasizes the use of standardized tools for initial and ongoing assessments to ensure consistency and comparability of data across clients and over time. This approach, while seemingly client-centered, fails to meet the specific requirements for standardized data collection mandated by the profession. Professional reasoning. Professionals should approach client assessments by first identifying the specific regulatory requirements and ethical guidelines governing their practice. This includes understanding the types of assessment tools that are mandated or recommended. When faced with a situation requiring assessment, the technician should select the most appropriate standardized tool for the presenting concern, administer it correctly, and document the results accurately. If there are time constraints or perceived urgency, the technician should advocate for the necessary time to complete a proper assessment or seek supervision to determine the most appropriate course of action within regulatory boundaries. The decision-making process should prioritize client safety, data integrity, and adherence to professional standards over expediency. Question 17. Operational review demonstrates a patient prescribed a daily antipsychotic medication reports experiencing significant nausea and dizziness, stating they feel they cannot take this anymore and are considering stopping the medication. As a mental health technician, what is the most appropriate immediate course of action? Option A. Document the patient's complaint in their chart and wait for the patient to bring it up again. Option B. Immediately inform the supervising nurse or physician about the patient's reported side effects and concerns. Option C. Advise the patient to stop taking the medication until their next scheduled appointment with the psychiatrist. Option D. Reassure the patient that these side effects are common and will likely pass without further action. The correct answer is B. Immediately inform the supervising nurse or physician about the patient's reported side effects and concerns. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the mental health technician to balance the patient's immediate comfort and reported side effects with the critical need for adherence to a prescribed antipsychotic medication regimen. Antipsychotics are vital for managing severe mental health conditions. An abrupt discontinuation or significant dose reduction can lead to relapse, symptom exacerbation, and potential harm to the patient or others. The technician must navigate potential communication barriers, the patient's subjective experience of side effects, and the objective medical necessity of the medication, all while operating within established protocols and under the supervision of qualified medical professionals. Correct approach analysis. The correct approach involves immediate, direct communication with the supervising nurse or physician. This aligns with the core ethical and regulatory responsibilities of a mental health technician, which mandate reporting significant patient concerns and observe changes to the appropriate medical authority. This ensures that any adjustments to the medication regimen are made based on a comprehensive medical assessment, considering the patient's overall condition, the medication's benefits versus risks, and established treatment protocols. This approach upholds patient safety by preventing unsupervised medication changes and ensures that the patient's reported side effects are addressed within a structured clinical framework, adhering to the principle of do no harm and the requirement for professional oversight in medication management. Incorrect approaches analysis. One incorrect approach involves directly advising the patient to stop taking the medication or significantly reduce the dose. This is a severe ethical and regulatory violation. Mental health technicians are not authorized to prescribe, discontinue, or alter medication dosages. Such an action bypasses the physician's medical judgment, potentially leading to dangerous withdrawal symptoms, relapse of the underlying mental health condition, and a breach of professional boundaries and scope of practice. This action directly contravenes regulations governing medication administration and patient care, which emphasize the role of licensed medical professionals in medication decisions. Another incorrect approach is to dismiss the patient's reported side effects without further investigation or reporting. This fails to acknowledge the patient's subjective experience and can lead to medication non-adherence if the side effects are indeed intolerable or indicative of a serious adverse reaction. Ethically, it demonstrates a lack of empathy and a failure to advocate for the patient's well-being. From a regulatory standpoint, it represents a failure to observe and report significant changes in patient condition, which is a fundamental duty of a mental health technician. A third incorrect approach is to simply document the patient's complaint without taking any immediate action to inform the supervising nurse or physician. While documentation is important, it is insufficient when a patient reports severe side effects from a critical medication. The technician has a duty to act on this information promptly to ensure the patient receives timely medical evaluation and appropriate intervention. Delaying this communication can have serious consequences for the patient's health and safety, violating the principle of timely intervention and professional responsibility. Professional reasoning. Professionals should approach such situations by prioritizing patient safety and adhering to their scope of practice. The decision-making process involves 1. Active listening and validation of the patient's concerns. 2. Immediate assessment of the severity of the reported side effects. 3. Prompt and clear communication of the patient's report and any observed symptoms to the supervising nurse or physician. 4. Following the instructions of the supervising medical professional regarding further assessment or intervention. This systematic approach ensures that patient care is evidence-based, ethically sound, and compliant with all relevant regulations. Question 18. The efficiency study reveals that a mental health technician is observing a patient who has recently started a new antidepressant medication. The patient is now exhibiting increased agitation, insomnia, and a noticeable tremor. The technician is aware that these symptoms can be side effects of certain antidepressants or could indicate a worsening of the patient's underlying anxiety disorder. The technician must decide on the most appropriate immediate action. Option A. Suggest to the patient that they might need a higher dose of their new medication to manage their symptoms. Option B. Advise the patient to stop taking the new antidepressant medication until their next appointment. Option C. Report the observed symptoms and the patient's recent medication change to the supervising nurse or physician immediately. Option D. Document the symptoms as typical for the patient's anxiety disorder and take no further action. The correct answer is C. Report the observed symptoms and the patient's recent medication change to the supervising nurse or physician immediately. Explanation. Scenario analysis. This scenario presents a common challenge in mental health settings where a technician observes a patient exhibiting symptoms that could be related to medication side effects or a worsening of their underlying condition. The professional challenge lies in accurately interpreting these observations and determining the appropriate course of action without overstepping the technician's scope of practice. Misinterpreting symptoms could lead to delayed or incorrect treatment, potentially harming the patient. Conversely, escalating every minor observation unnecessarily can burden the clinical team and disrupt patient care. The technician must balance vigilant observation with an understanding of their role and the established protocols for reporting and intervention. Correct approach analysis. The correct approach involves recognizing the patient's symptoms, understanding that these symptoms could be indicative of a medication-related issue, either a side effect or a need for dosage adjustment, and then following the established protocol for reporting such observations to the supervising nurse or physician. This aligns with the mental health technician certification's emphasis on patient safety and adherence to the scope of practice. Technicians are trained to observe, document, and report, but not to diagnose or prescribe. Reporting the observed changes to the appropriate clinical staff ensures that a qualified professional can assess the situation, review the patient's medication regimen, and make informed decisions about further management. This upholds ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Incorrect approach is analysis. One incorrect approach is to assume the symptoms are solely due to the patient's underlying mental health condition and not report them. This fails to acknowledge the potential for medication side effects, which is a critical aspect of patient monitoring. Ethically, this could be seen as a failure of diligence and a potential breach of the duty of care, as it overlooks a possible cause of the patient's distress. Regulatory frameworks for mental health technicians emphasize proactive observation and reporting of any changes that could impact patient well-being. Another incorrect approach is to independently adjust the patient's medication or suggest specific medication changes. This directly violates the scope of practice for a mental health technician. Technicians are not authorized to prescribe, adjust dosages, or recommend specific medications. Doing so would be a serious regulatory and ethical violation, potentially leading to patient harm and disciplinary action. It bypasses the established chain of command and the expertise of licensed medical professionals. A third incorrect approach is to dismiss the symptoms as insignificant or a normal part of the patient's behavior without further investigation or reporting. While some behaviors might be transient, a responsible technician must consider the possibility of a medication-related issue. Failing to report could mean missing an opportunity to intervene early, which could lead to more severe consequences for the patient. This demonstrates a lack of critical thinking and adherence to the principle of thorough patient assessment. Professional reasoning. Professionals should employ a systematic decision-making process when encountering patient changes. This involves 1. Observation. Carefully and objectively observe the patient's behavior, mood, and physical presentation. 2. Identification of potential causes. Consider all possible contributing factors, including the patient's underlying condition, environmental influences, and medication effects. 3. Scope of practice awareness. Determine what actions are within the technician's authorized role and responsibilities. 4. Reporting protocol. Adhere strictly to the facility's established procedures for reporting observations to the appropriate clinical staff, e.g., nurse physician. 5. Documentation. Accurately and contemporaneously document all observations and actions taken. 6. Collaboration. Be prepared to provide clear and concise information to the supervising clinician to facilitate their assessment. This framework ensures that patient safety is paramount, regulatory requirements are met, and ethical obligations are fulfilled. Question 19. Implementation of a new antipsychotic medication for a patient has led to the patient reporting new and concerning physical symptoms, including tremors and a feeling of restlessness. As a mental health technician, what is the most appropriate immediate course of action? Option A. Immediately report the patient's new symptoms and concerns to the supervising nurse or physician for further assessment and intervention. Option B. Administer an over-the-counter medication to help the patient feel more comfortable while observing for symptom resolution. Option C. Observe the patient closely for further changes and document all observations meticulously before reporting to the supervising nurse. Option D. Reassure the patient that these symptoms are likely normal side effects of the new medication and encourage them to tolerate it. The correct answer is C. Observe the patient closely for further changes and document all observations meticulously before reporting to the supervising nurse. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a mental health technician to balance immediate patient comfort and safety with the need to adhere to established treatment protocols and report critical observations. The technician must recognize subtle but significant changes in a patient's presentation that could indicate a serious adverse reaction to medication, necessitating prompt and appropriate action without overstepping their scope of practice. The urgency of the situation, coupled with the potential for patient harm, demands careful judgment and a systematic approach. Correct approach analysis. The correct approach involves immediate, direct observation and assessment of the patient's symptoms, followed by prompt reporting to the supervising nurse or physician. This aligns with the core responsibilities of a mental health technician, which include observing patient behavior and physical status, and reporting any changes or concerns to the appropriate clinical staff. This approach prioritizes patient safety by ensuring that potential adverse effects are identified and addressed by qualified medical professionals in a timely manner, adhering to established protocols for medication management and patient care within the regulatory framework for mental health technicians. Incorrect approaches analysis. One incorrect approach involves delaying reporting to observe the patient further without consulting the supervising nurse. This failure to promptly communicate critical changes to the clinical team can lead to a delay in diagnosis and treatment of a potentially serious adverse drug reaction, violating the ethical duty to protect patient well-being, and potentially contravening regulatory guidelines that mandate timely reporting of patient status changes. Another incorrect approach is to administer an over-the-counter medication to alleviate the symptoms without a physician's order or consultation with the supervising nurse. This action exceeds the scope of practice for a mental health technician, as it involves independent medical decision-making and drug administration, which are typically reserved for licensed medical professionals. Such an action could mask symptoms, interfere with proper diagnosis, or even exacerbate the patient's condition, leading to regulatory and ethical violations. A third incorrect approach is to dismiss the patient's complaints as typical side effects without thorough assessment and reporting. While some side effects are expected, a significant change in presentation, such as the described symptoms, warrants professional evaluation. Failing to investigate and report such changes demonstrates a lack of diligence and can result in misdiagnoses of serious adverse events, compromising patient safety and violating professional standards of care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with direct patient observation and assessment. This should be followed by immediate communication of findings and concerns to the supervising clinician. The technician's role is to be the eyes and ears of the medical team, identifying and reporting changes, not to independently diagnose or treat. Adherence to the established chain of command and reporting protocols is paramount for ensuring patient safety and maintaining professional accountability within the regulatory framework. Question 20. Stakeholder feedback indicates a need for improved clarity in how mental health technicians approach the classification of mental disorders. A client presents with significant distress and reports experiencing auditory hallucinations and disorganized speech. Based on the recognized diagnostic framework for this jurisdiction, what is the most appropriate initial step for a mental health technician in classifying this client's potential disorder? Option A. Classify the disorder based on common societal perceptions and stereotypes of individuals exhibiting such symptoms, without a formal diagnostic evaluation. Option B. Immediately assign a diagnosis of schizophrenia, as auditory hallucinations and disorganized speech are commonly associated with this disorder. Option C. Rely on the client's self-report of hearing voices as the primary indicator and proceed with classifying the disorder based on this single symptom. Option D. Conduct a comprehensive assessment to gather detailed information on the nature, duration, and severity of symptoms, as well as their impact on the client's functioning, while considering differential diagnoses according to established diagnostic criteria. The correct answer is D. Conduct a comprehensive assessment to gather detailed information on the nature, duration, and severity of symptoms, as well as their impact on the client's functioning, while considering differential diagnoses according to established diagnostic criteria. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a mental health technician to interpret and apply diagnostic criteria for mental disorders in a real-world context, where client presentation can be complex and nuanced. The technician must balance the need for accurate classification, which informs treatment planning and resource allocation, with the ethical imperative to avoid misdiagnosis or stigmatization. The pressure to quickly categorize symptoms can lead to oversimplification or reliance on superficial observations, undermining the therapeutic relationship and potentially leading to inappropriate interventions. Correct approach analysis. The correct approach involves a systematic and evidence-based method for classifying mental disorders, adhering strictly to the diagnostic manual recognized within the relevant jurisdiction, e.g., DSM-5-TR in the U.S. This approach prioritizes a comprehensive assessment that considers the full spectrum of symptoms, their duration, severity, and impact on functioning, as well as relevant contextual factors. It emphasizes differential diagnosis, ruling out other potential conditions or medical causes. This aligns with professional standards and regulatory guidelines that mandate accurate and ethical client assessment, ensuring that interventions are tailored to the individual's specific needs and that appropriate care pathways are followed. Incorrect approaches analysis. One incorrect approach involves relying solely on a client's self-reported primary complaint without further investigation. This fails to meet the professional standard of a thorough assessment. Ethically, it risks misinterpreting a symptom as the primary disorder when it may be secondary to an underlying condition, leading to ineffective treatment and potentially delaying appropriate care. Regulatory frameworks typically require a comprehensive evaluation process. Another incorrect approach is to immediately assign a diagnosis based on a single prominent symptom that appears to fit a common disorder. This is a form of diagnostic shortcut that ignores the complexity of mental health presentations and the requirement for a constellation of symptoms and functional impairment as outlined in diagnostic criteria. This approach violates the principle of accurate diagnosis and can lead to mislabeling, which carries significant ethical and practical consequences, including inappropriate treatment and potential stigma. A third incorrect approach is to classify the disorder based on anecdotal evidence or common stereotypes associated with certain behaviors, rather than objective diagnostic criteria. This is not only unprofessional but also unethical, as it promotes bias and discrimination. Diagnostic manuals are designed to provide objective, standardized criteria to ensure consistency and fairness in diagnosis, and deviating from these criteria undermines the integrity of the mental health system and can cause harm to individuals. Professional reasoning. Professionals should approach the classification of mental disorders by first understanding the specific diagnostic manual and its guidelines mandated by their jurisdiction. This involves a commitment to continuous learning and adherence to ethical codes. When faced with a client, the process should begin with building rapport and conducting a thorough history, followed by a systematic assessment of symptoms, functional impairment, and relevant history. This assessment should be guided by the diagnostic criteria, employing differential diagnosis to explore all possibilities. Documentation should be meticulous, reflecting the assessment process and the rationale for any diagnostic conclusions. If uncertainty exists, consultation with supervisors or more experienced clinicians is a crucial step in professional decision-making.